My name is David Schuster. I am the Division Director of Nuclear Medicine and Molecular Imaging at Emory University in Atlanta, where I am a professor. To understand normal biodistribution on PET-CT, first one has to stipulate what kind of PET, because we are now using more and more radio tracers than we did in the past. Currently, most oncologic PET is with FDG or 18F fluorodeoxyglucose. Now, this is a radioactive glucose which gets taken up by cells, then it's irreversibly phosphorylated, and for all practical purposes, it's trapped in the cell for most cancers. Now, most cancer use more glucose than normal cells, but FDG uptake is not specific to cancer. We could see it with variety of inflammatory and other benign etiologies. So to read PET well, one must be familiar with normal biodistribution. Typically, brain and the GU system has intense FDG uptake as the brain uses glucose for energy and FDG is excreted by the kidneys. Other organs have varying degrees of normal uptake from mild to moderate. For example, the heart and muscle can have variable activity depending on the patient's fasting state. The liver and spleen typically have mild to moderate heterogeneous activity. And we could see variable uptake with bowel. For example, we know patients who are taking metformin can have fairly intense bowel activity. And that's something that it's always good when you're reading a PET to see what medications the patient is on. Now, GYN activity, both within the uterus and the ovaries, is really dependent on what stage the patient is in relation to menopause. So premenopausal women, for example, can have variable degrees of FDG uptake. For example, endometrial activity, very common, and cycling with ovulation within the ovaries. Most of the time in one ovary, but sometimes a woman can ovulate from both ovaries. And postmenopausal, if we see such uptake, for example, within the uterus or the ovaries, then we start to get really nervous that there may be, some type of neoplasia or other bad actor going on. Leiomyomas within the uterus are similar. Premenopausal, it's very common to see even intense FDG uptake, while postmenopausal, one really shouldn't see that.